Good morning, everybody. Can y'all hear me?
Yes,
Yeah.
sir.
Yes.
Yes, sir.
Great. Thank you for the feedback. Good morning. I'm Joey Hopkins, Secretary of North Carolina Department of Transportation. Happy to host this meeting this morning for the Executive Committee Highway Safety. This is the first time I've been part of this meeting, so glad to do that. Glad to be part of it, and want to thank everybody for participating this morning. It's my understanding that this group hadn't met recently, so I would like to start in just a minute with introductions. And since we're online, I'm gonna just try to call people out in the order they're on my screen. So it's not necessarily alphabetical, but if you can, when I call your name, just introduce yourself and tell us who you're representing. And it should go pretty quick, but I think it'll be good for everybody just to put a face with a name. If you've got a camera on your computer, that would be great. If not, that's fine too, but still, please introduce yourself. But before we start that, just a little bit of background for folks that may not know me. Again, I'm Secretary of Transportation. I was named Secretary in October of last year. So just a few months in, but I'm not new to transportation. I'm a career DOT employee. I've been an employee of DOT really starting in a temporary role when I was in college back in the 80s, probably before some of y'all were born. But I started permanent in 1990. I've had a number of roles in the department, but every one of those roles I dealt with safety, either employee safety or public safety. So it is near and dear to my heart, and it's something that always needs to be at the top of our list at the department, and will be as long as I'm here. I'm probably preaching to the choir, but I know everybody here knows, and I don't want to steal any of Chris's thunder in a few minutes, but fatalities and fatal crashes are down a little bit this year, which is a good thing, around 7% overall, but they're still higher than the 5-year average. And at the end of the day, when you look at the numbers, I think there's nearly 700 fatal fatalities in the state this year, and that's really high. So any way you look at whether we're trending in a good direction or not, that's something we all need to be aware of and be working together to try to solve that problem. So let's move into introductions. I will start. The first name on my list is Alan. It says guest. I'm not sure Alan's last name, but I see Alan here.
Hi, this is Alan Della Penna. Perhaps that's me. I'm a consultant with the Division of Public Health, Injury and Violence Prevention Branch.
Thank you, Alan. I appreciate that. Aleem, I think you're next. You're muted, Aleem.
Hi, everyone. This is Ali Mohammed. I'm with the Institute for Transportation Research and Education over at North Carolina State University. I handle their data analytics stuff. So, well, thank you.
Thank you, Aleem. And I think you were just the first and probably what will be more people that have little technology issues, but thank you for that. Allison is next. Allison, I don't have your last name on my sheet.
Hi, I'm Allison Simpson. I am an advocate with Bike Durham and Families for Safe Streets after my husband was killed by a speeding driver in 2022.
Thank you for joining us, Allison. Ike Avery.
Hello, I'm Ike Avery. I'm a traffic safety resource prosecutor with the Conference of District Attorneys. And I've been around state government longer than you have, Joey.
So there is one person with a little bit more, maybe not age, but a little bit more time than I've got. Welcome, Mike.
Thanks.
Billy Williams, you're next.
Good morning, everybody. Billy Williams. I'm the director of ITRI, where Aleem is, and I think we've got a few more folks on the call.
Thank you, Billy. Appreciate y'all joining us this morning. Lori Brown.
Good morning. I am Lori Brown, and I am a highway safety Specialist with the Governor's Highway Safety Program.
Thank you for joining us, Lori. Ryan, you're up.
Good morning, Ryan Brumfield, NCDOT Director of Strategic Initiatives.
Thank you, Ryan. Good morning, Dale. Your turn now.
Dale Privet.
Morning.
Sorry, Dale McKeel.
Oh, I'm sorry. I saw your name on there too, Dale Privet. This is for Dale McKeel.
All right, good morning. I'm Dale McKeel and I work with the North Carolina Conservation Network. Great to be here.
Thank you. I'm gonna call you Dale number one, Dale. Jennifer Delcourt.
Hi, everyone. I'm a grant specialist with Governor's Highway Safety Program. I'm here today because we've been participating in the Strategic Highway Safety Plan and also standing in for our director who's out of the country, Mr. Mark Gazelle.
Thank you, Jennifer. Glad to have you. Commissioner Goodwin. You're muted too, Commissioner.
I guess I have those technology issues you're talking about. DMV Commissioner Wayne Goodwin, I've been around the block a while wearing many hats since 1996. So happy to be here with every one of you. Thank you, Mr. Secretary.
Thank you, Commissioner. Gregory Ferrara.
Everyone. Greg Ferrara, ITRI, NC State University.
Thank you, Greg. Appreciate
Thank
that. Heather Hildebrand.
This is Heather Hildebrand, statewide initiatives, here to help support, VMT reduction and safety in that segment. So good afternoon or good morning, everyone.
Thank you, Heather. Ian Hamilton.
Morning, everybody. Ian Hamilton with VHB.
Good morning, Ian. Thank you for being here. Jennifer Smith.
Good morning, it's Jennifer Smith. I'm from the East and I'm also representing Sedgwick, North Carolina.
Thank you, Jennifer. Yolanda Jordan.
Hi, Yolanda Jordan, Division Administrator, Federal Highway Administration. Glad to be here.
Welcome, Yolanda, you and your staff. Kara Peach.
Good morning, Kara Peach with VHB and here supporting the Strategic Highway Safety Plan update.
Thank you, Kara. Thank y'all for being here. Is it Else Keefe? And I apologize if I didn't say that correctly.
No worries. It's Elise Keefe. Hi,
Elise.
Good morning, everybody. I'm at the UNC Injury Prevention Research Center and along with my colleagues over at the Highway Safety Research Center, we support NC Vision Zero communities across the state.
Thank you, Elise. Kim Eccles.
Hey, good morning. Kim Eccles. I'm like Kara and Ian. I'm also from VHB and supporting the SHSP.
Good morning, Kim. Terry said to tell you, hey, just FYI.
Please share the same.
Lauren Blackburn.
Hey, good morning. Lauren Blackburn with VHB as well, and I'll be speaking to the Vulnerable Road User Safety Assessment later on.
Thank you, Lauren. Cheryl Leonard.
Good morning. This is Cheryl Leonard. I'm with the Governor's Highway Safety Program. I'm Assistant Director. Thank you.
Hey, Cheryl.
Good morning.
Good morning. Brian Mayhew.
Good morning. I'm Brian Mayhew, State Traffic Engineer with NCDOT. I've not been here quite as long as Joey, but a good while, a few decades. So glad to be here.
Hey, Brian. Nicole McGarity.
Good morning, everyone. I'm Nicole McGarity with AAA, the Auto Club Group in the Carolinas, and I am in public affairs where we concentrate on advocacy, education, and research. So looking for all those partnerships out there. Glad to be here. I am going to be putting in the chat, just to give you an FYI, our Traffic Safety Foundation is going to be having a safe mobility conference in Chapel Hill in March, and we would love for all of you to attend. It's going to be some great speakers and information and research there.
Thank you, Nicole. Appreciate you sharing that information too.
Sure.
Lydia McIntyre.
Yes, Lydia McIntyre, Greensboro DOT and the MPO, and I have to lead our Vision Zero efforts in Greensboro. Thank you.
Thank you, Lydia. Michael Messer.
Hey, good morning. This is Todd Messer. I'm the Education Manager with North Carolina Office of EMS.
Thank you, Todd. Brian Murphy.
Good morning, Brian Murphy, NT Traffic Safety Unit.
Hey, Brian. Chris Oliver.
Good morning, Christopher Oliver, Traffic Safety Specialist with the North Carolina Department of Transportation, also with the Traffic Safety Unit.
Thank you, Chris. Dale Privet or Dale number 2.
Good morning, Secretary Hopkins. Dale Privet with Federal Highway, North Carolina Division, Safety Lead. Thank you.
Thank you, Dale. Good to see you. Laura Sant.
Good morning. I'm Laura Sant with the UNC Highway Safety Research Center. I'm the co-director of the center.
Thank you, Laura. Warren Smith.
Hi, good morning. Warren Smith with the North Carolina Governor's Highway Safety Program and the Planning Programs and Evaluations Manager.
Thank you, Warren. And I need to apologize in advance. Rahagban Srinivasan.
Yes, so this is Raghavan Srinivasan. I'm also with the UNC Highway Safety Research Center.
Thank you, Raghavan. Appreciate that. Is it Tanner Nelson?
Yes, sir. Tanner Nelson from Itri at NC State University. Glad to be here.
Thank you, Tanner. And Terry, I don't have a last name.
Terry Lansdale, good to see you, Secretary. Terry Lansdale with Bike Walk, North Carolina.
Yeah, good to see you too, Terry. Sean Troy.
Yeah, I'm Sean Troy with the NCDOT Traffic Safety Unit.
And the last name I have is Anna Waller.
Hi, I'm Anna Waller. I'm at UNC and I work with Laura and others at HSRC. And I'm just here representing Katie Harmon's project because Katie was unable to participate today. Thank you.
Thank you, Anna. Did I miss anybody or did anybody join after we started?
Mr. Secretary, this is Tony Hayes with the North Carolina Commission of Indian Affairs representing the American Indian tribal community.
Okay, Tony Hayes, is that right?
That is correct.
Okay, thank you, Tony. Thank you for joining. Anybody else? Well, good morning again and welcome to everybody. I appreciate y'all entertaining me for a short minute. We'll move right into the agenda. I know everybody is busy today, but I will, Chris, before I turn it over to you, if you and Brian can help me, certainly we want this to be interactive. I know that's difficult when we're online, but if you don't mind raising your hand, if you've got a question or a comment, and Brian, if you and Chris can help me kind of monitor that, we will call on you just as quick as we can, just to help make this work a little bit better if possible. But Chris, if you don't mind, give us an update on the fatal and serious injury trends.
Just trying to make sure everyone can actually see the slide presentation.
Yes, sir.
So as the Secretary mentioned, while our 2022 statewide fatality numbers, they fluctuated throughout the year, but it did finally settle at 1,797 persons killed on our roadways. Our 2023 fatalities are currently lower when compared to last year's numbers. And although it should be considered as preliminary, our 2023 year-to-date fatalities are currently down about 7% when compared to last year. So based on previous history, we know these numbers will increase over the next few months as the crash reports continue to come into DMV. And unfortunately, as people in the hospitals pass away from injuries sustained in crashes that occurred last year. So again, just some good news to start the year. So when we compare our 2022 and 2023 fatality trends for our North Carolina Strategic Highway Safety Plan emphasis areas, we currently are seeing a decrease in most areas. But just to point out a few of the emphasis areas, The substance impaired driving category is currently seeing the largest reduction at 23% from 2022 to 2023. The alertness category is currently seeing a 17% reduction from 2022 to 2023. Our lane departure category, which traditionally we see our most number of fatalities in, is currently seeing a 16% reduction from 2022 to 2023. While the overall numbers are small, unfortunately, we are currently seeing our largest increase in the bicyclist category, which have more than doubled from 2022 to 2023. Moving along to our serious injuries. And again, while the numbers should be considered as preliminarily, unfortunately, we're currently seeing an increase in our 2023 numbers with 5,463 persons seriously injured in traffic crashes. So when looking at 2022 to 2023, this represents a 4% increase in our statewide serious injuries. And since the first full year of reporting from the serious injury definition change in late 2016, we currently are seeing a 19% increase in our statewide serious injury numbers from 2017 to 2023. And again, just comparing the 2022 and 2023 serious injury trends for our current North Carolina Strategic Highway Safety Plan emphasis areas, we currently are seeing an increase in most areas. And again, I'll just point out a couple of the emphasis areas. And again, while the numbers are small, the bicyclist category is currently seeing the largest increase at 38%. Our younger driver emphasis area is currently seeing a 14% increase. And our intersection emphasis area is currently seeing a 13% increase. And we currently are seeing our largest reduction in the pedestrians category with the 8% decrease. So as you can see, we do have some good news, but we still have lots of work to do, which we definitely should keep in mind as we move forward with updating the emphasis area strategies found in our statewide strategic highway safety plan. With that, that's actually the last slide in my presentation. I'm sure if there are any questions.
Are there any questions for Chris or comments?
Joey, I'll make one comment. This is Brian Mayhew. It's of note, as you know, Chris mentioned, the increase in bicycle fatalities is something that's definitely kind of jumps out on that chart. It's not unusual for the bicycle fatalities in particular to fluctuate significantly from year to year, or that's just being a relatively small number. It can show that change rather easily, but it is something that's definitely of note. And the traffic safety unit staff is going back and reviewing each individual crash report for those crashes to try to get a better understanding of any characteristics or trends that we could see in that.
Thank you, Brian, for that. Yeah, I think that's pretty alarming. I agree that the numbers are small, so it doesn't take much to make a difference, but that's a pretty big difference in that. And you know, we've got a growing state, a state that people want to live at and vacation at, and our bike population is growing too. So that's something I think we need to keep an eye on and look to do more things to make bicycling safer in the state. Thank you both for that. Any other questions or comments? Okay, I'm gonna move to Laura. She's gonna review some available state safety data resources, if you don't mind.
Thank you, Joey. Are you able to see my slides right now?
Yes.
Excellent. Well, yes, Chris just asked me to give sort of a highlights reel of some of the data resources and tools available to look at safety data in North Carolina. And I have gathered some materials really with a lot of help from my colleague Katie Harmon, Anna Waller, who's on the call, as well as Amy Icing. So I really appreciate the input from the folks at UNC that have put some materials together. And I think just to acknowledge we have a diverse group of folks in the room. We may all be using safety data differently. The trends that Chris just showed is only one use. I know we're doing a lot of work in research trying to really understand risks and think about how we can evaluate different safety interventions. But safety data really are critical to a lot of different efforts that are happening around the state. And another, I think, point to acknowledge is that we may all be defining safety a little bit differently. So sometimes it's challenging to have a conversation around safety data because really a lot of times we're talking about measures of unsafety when we talk about fatalities or injuries. But as we start discussions around safe system, we're also moving into discussions around inherent latent risks and exposure to risk. And how do we measure that as a predictor of potential safety? And certainly we're seeing a lot of movement across the US to start integrating health more and think about safety as one aspect of overall well-being, health, security, and comfort. And so we have a lot of work to do to sort of measure these different aspects of safety. But I'm really going to focus today's commentary on the data sources that we have that really help us understand primarily fatalities and injuries that are on the left side of the spectrum. And when we think about fatalities and injuries, we know that there's a lot of different ways that you can measure these outcomes, whether you're looking at deaths or disabling injuries, whether you're looking at the subset of injuries that have received medical attention, or the broader set of events that may have been a near miss or a near collision. And when we're looking at injuries and deaths, we really rely, I would say, on what we call the big four: crash data, EMS, emergency department data, and trauma registry data. Those are really the rich sources of information about crashes, the crash context, as well as the injury outcomes and patient outcomes. And as this shows, deaths are really only the tip of the iceberg. And for each fatality in North Carolina, we see on average about 85 medically attended injuries. So several years back, we were funded by the Governor's Highway Safety Program to begin a project looking at how we might integrate different sources of data with police reported crashes. And we looked at 12 different sources of information on injury in North Carolina. We gathered these, we documented them, we pulled together the data dictionaries, and we have these on one of the websites that I'll share later. But again, I'm going to really focus today's conversation on the four major sources that we've been using, especially in our research at UNC. So police reported crash data, I'm sure most of you are familiar and probably have a lot more expertise even in the police reported crash data systems and applications in North Carolina. But really, I wanted to highlight a couple of different ways that we're seeing communities use these crash data. We see a lot of folks that are using the portals that NCDOT developed. There's the map here showing the geolocated crashes from 2018 to 2022. And we also see a lot of folks using the Vision Zero portal that Greg Ferrara's team at ITRI has put together. So there's a lot of material kind of pre-designed for people to understand different safety issues and trends and be able to look at different communities. Let me go back a little bit. But one thing we also wanted to point out is that these data usually come with a lag because they're cleaned up and they're processed. And a lot of times in that process, there's a lot of work to make corrections to the location or the milepost, or whether it was, a bicyclist who is coded as a pedestrian. And so they're not necessarily real-time data, but they are handled and corrected for accuracy. But a lot of communities are still interested in more near-term, real-term data. And so we wanted to point out that TEAS is another system available that NCDOT provides. That's the Traffic Engineering Accident Analysis System. And the link is there. And usually if a crash occurs, it's in the TEAS system within about 30 days. And there are trainings available on how to access and use the TEAS system. Again, knowing that the data are not as cleaned up, but the value is that you can see more recent incidents that are occurring. And we have an upcoming training in March, and it seems like a lot of the Vision Zero communities are interested in learning a little bit more about this and how it can also relate to the work that they're doing under Vision Zero. The one thing that is sort of a global challenge with the police reported data is that we know that this is only a subset of all incidents, that by design, there are certain crashes that are not deemed reportable. And that with some of the emergent micromobility modes like e-scooters and e-bikes, our systems really haven't caught up to systematically capture those. And so there's sort of a little bit of additional work that needs to be done searching the narrative to try to identify those types of crashes in the police reported data sets. The other thing that we're seeing a lot of research published around is how underreporting might be a systematic issue for all police reported data, particularly in that there may be people who choose to not report, or there may be cases where people go directly to seeking medical attention, especially younger children and older adults, and somehow they don't end up getting a police report. And so there's a lot of research happening to understand sort of the systematic undercounting of different populations and why that is and what we can do to better account for that data missingness. And so again, this is just an example of how crash data can give us one picture of the reported incidents, but we have complementary sets of information like emergency department data that can give us a much richer set of information about incidents, especially things like falls and injuries affecting people that weren't hit by cars. We do see a lot of bicyclist injuries where the bicyclist may have been run off road by a car. They may have fallen over a railroad track. They may have had some kind of interaction with the built environment or the traffic environment, but that led them to have a single person incident. And what we're seeing is that those are really much better captured in the emergency department data. And so that leads me to share some highlights of the emergency department resources that we have in the state. And this is really where my colleague Anna Waller and Amy Ising and Katie have done a lot of great work managing and working with the NC Detect data. So NC Detect is our state's syndromic injury surveillance system. And like the TEAS data that I mentioned, it is very close to real time. And it's very useful for monitoring trends or looking at things that are emergent issues like COVID related changes that were happening, as well as all of the more recent e-scooter and e-bike crashes. It actually does have standardized codes where you can draw out those micromobility related crashes. So again, it gets a lot of data updated several times a day, even hourly, from different data sources, and it all flows into NC Detect. And the NC Detect website is a really great resource where you can request an account, you can get training on how to use it, and they even have a number of pre-designed dashboards where you can also just look at tables and you can generate maps and as well, in addition to the line listing reports that you can get. So here's just an example of the emergency department data. You can look at pedestrians involved in motor vehicle crashes alongside of other pedestrian related incidents that may not have involved a vehicle, and you can parse those out. in the emergency department data. I'll very briefly touch on trauma data as another healthcare data resource. We do have information about it also on the Carolina Center for Health Informatics website. The main thing to note is that it can be challenging to access due to the HIPAA requirements, and it really only represents those most severe injury cases. But it provides a lot of useful data about patient and injury outcomes that may be more detailed than what we might get from the police reported data. And similarly with the emergency, the EMS data, the main thing that we can point out here is that, I guess, in contrast to the trauma data has a lot of patient outcome data, but it doesn't have a lot of context on where the incidents occurred. The EMS data is actually really good at documenting the incident location and the time with great accuracy. And what we found is that a lot of the incident narratives have a lot of useful information for safety analyses. For example, they very consistently capture driver location, occupant location in the vehicle, as well as their restraint use. So information that we can't always get reliably from the traffic crashes, the police reported traffic crashes, we can get from this data. And the other thing I'll note is that, excuse me, in North Carolina, they've recently transitioned to the NEMSIS, the National System Standard, and we're sort of waiting to see what that might mean for changes in our data. You can find a little bit more detail about on the Carolina Center for Health Informatics website. There's a lot of publications about these different data sources and what we've learned from analyzing them. And the dashboard sort of does a deeper dive into some topic specific issues. And again, all of that work came out of funding that we received from the Governor's Highway Safety Program to really start to assess these different data sets and build towards the ability to link these data sets. And we're continuing to find funding and develop more long-term sustainability plans for these kinds of data linkage and data improvement efforts, as well as figure out how we can really showcase the insights that analyzing these data sets can offer. So we've done a number of different pilots on linking different data sets. And these have really helped us to understand better the nature of injury in North Carolina, healthcare usage, and medical outcomes, and also to identify disparities that we might be seeing in injury outcomes. So for example, the image on the left shows you that bicyclists were very much overrepresented in hospital admission rates compared to other modes of traffic-related incidents. And when we had a study that was examining child pedestrian injuries, with the linked data, we were able to also understand the source of payment for their treatment, so that we can see Medicaid is very much overrepresented as a source of payment when only 15% of the population receives Medicaid, but among those children injured, 47% are using Medicaid as their form of injury payment. So the linkage work is giving us those kinds of insights into the burden of injury and the cost to the state, but it's also helping us to assess the quality of our other data sources. So when we can compare how police reported assessment of injury is to the clinical assessment, we can see where there might be differential. So for example, this study looked at pedestrians treated and found that 50% of those that were defined by police as level B, suspected injury, really were defined as serious injury in the clinical assessment. And that 161 of these pedestrians who were classified as not injured actually ended up receiving medical treatment. So it helps us to really understand the gaps in our data and where other data sources can provide a bigger picture. So as I mentioned, we're continuing to move forward with improving these data and integrating them with programs like Vision Zero to see how these data can help the communities across the state inform their decision-making and their safety planning. And again, we're all moving towards measuring not only fatalities and injuries, but how can we better understand the exposure to risk from the built environment or from other behavioral or community factors. And having more healthcare data also helps us understand comorbidities and issues related to population level health that may be a risk factor that's contributing to the trends that we're seeing in deaths and fatalities, or fatalities and injuries. And we also just wanted to point out the work that's happening across the state, both at the community level and with NCDOT. Brian Mayhew's group is doing a lot of work looking at systemic risk analysis. How can we use other data sets about our roadway system to help us identify risks? And I think we could have an entirely separate conversation there. And then within the Vision Zero communities, we're seeing a lot of work too to acknowledge that with all of our injury data, we're measuring unsafety and not necessarily safety or perceptions by the community. And so there's still a lot of effort to engage communities to understand what the community knowledge and information can inform in terms of our safety and be a really useful source of safety data as well. So there's work happening everywhere, I guess, is my takeaway message, to improve and to actually utilize all these different sources of safety data. And Warren, I think I saw him on the call as well. He's in charge of the North Carolina Traffic Safety Information System Strategic Plan. That plan is a very rich source of information about these different safety data systems. I've only touched on a few here, but certainly there's a lot of work going on with the Traffic Records Coordinating Committee to continue improving and utilizing these different resources. So there's some links here for anybody who wants to learn more. And I'm sure I've taken my full amount of time. So thank you so much for the opportunity to share.
Laura, thank you so much for the presentation. A lot of good information here, and for your work to research these different data sources and also to develop the linkages. This is pretty amazing and good stuff that y'all are doing. And thanks to GHSP for helping to fund this. Any questions or comments for Laura in the group? Thank you again, Laura.
Thank you.
So now we're going to move to Brian Mayhew. He's going to review the North Carolina 2023 Vulnerable Road User Safety Assessment.
Yeah, thanks, Joey. And with me today is Lauren Blackburn from VHB. She's going to walk us through a lot of slides and information about the process and methods that we use for this. But I'll get us kicked off on it. But so the Vulnerable Road User Safety Assessment was a requirement in recent federal legislation. And it really allowed us in North Carolina to build on what we were already doing. So the new federal requirement did require all states to do robust analysis on vulnerable road user safety. And vulnerable road users were defined as pedestrians, bicyclists, and any person on a personal conveyance. So in theory, that would include wheelchairs and scooters, that type of information, as best as we can get it from the data that's available to us. So it really did kind of encourage us to build on what we had been doing in recent years, take a more thorough look, and also do a lot of additional engagement with other partners across the state. So with that, I'll turn it over to Lauren. She can walk us through what we did for our road user safety assessment in North Carolina.
Thanks, Brian. So Brian just mentioned that this is still a relatively new requirement for all the states in the United States as part of the new Infrastructure Act as of a few years ago. And it did include within the definitions of what we were asked to look at is pedestrians, bicyclists, and persons otherwise using some form of personal conveyance. The requirements of the infrastructure law is to conduct a quantitative data analysis of especially the fatal and serious injury crashes. Didn't limit us from looking at all the other injury or non-injury crashes, but primarily to focus on those fatal and serious injury bicyclist and pedestrian crashes in order to identify high-risk areas or types of locations that could be considered high risk. So in addition to looking at just the crashes themselves, the crash reports, we also looked at it with regards to location, the roadway types, speed, even the time of day and month and so forth for when those crashes occurred. We also looked at it based on demographic information. We looked at a whole host of information to be able to help us better understand things like overrepresentation based on the person's race, ethnicity, income, and age. It was due to be completed by last November, and it was. So it is part of the SHSP as of when the Vulnerable Road User Safety Assessment was concluded. But moving forward, it's going to be updated every 5 years as part of the SHSP moving forward. So again, just to reiterate that timeline, we started last fall or fall of 22 to look at a sample of fatal and serious injury pedestrian crashes. I'll talk more about that in just a moment. Then we also looked at it more spatially across the whole state. We also analyzed crash patterns and different characteristics of those crashes of all injuries for each of the MPOs and RPOs. We met with each MPO, which stands for Metropolitan Planning Organization, or Rural Planning Organization, in the winter, spring months of this last year in order to engage with them and learn more about some of the local conditions. And then we worked from that to develop a series of strategies, which are combined in a final report, which was submitted to Federal Highway last November. So just to reiterate some of that, as I mentioned before, we looked at a sample of fatal and serious injury pedestrian crashes. The point of that was to identify some additional variables that we can't find in crash reports in order to help us better understand some of the underlying conditions and problems. We also looked at demographic and other physical characteristics of where all the crashes, both bicyclists and pedestrians, occurred over a 10-year period. When we were conducting consultation, as it's referred, we did reach out to all the tribal organizations to see if they wanted to talk more about some of the local conditions. We also hosted about 37 meetings with each MPO and RPO in the state, again, to share some of the information that had been analyzed and talk more about some of the programs and resources that NCDOT leads. And so we identified a number of high-risk characteristics that helped us better understand what can be called a high-risk area. We did not identify specific locations per se for the Vulnerable Road User Safety Assessment, but really more about those types of locations. And then that helped inform a series of strategies that Brian will talk more about in just a minute. One of the resources that was created of that sample set that was reviewed, again, these were just pedestrian crashes, fatal and serious injury. About 500 of them crash reports were reviewed in depth, and the locations at the time of the crash to help us identify additional information that we didn't have before. I can put a link to this viewer in the chat. It's available for anybody to check out. It gives you some toggling tabs to check out to learn more about things like, whether a crosswalk was present at different types of crashes and things like that. Some things we learned, about 73% of fatal and serious injury pedestrian crashes occurred outside of intersection locations. This is consistent with national trends. About 70% of those same crashes occurred in non-daylight or dark conditions, and about 66% occurred in areas where the percent of households in poverty is greater than the state average. There's a lot of other statistics like this that you can find in that VRU dashboard that I mentioned a moment ago. Other things that we looked at is when, for example, a vehicle was turning and struck a pedestrian, 65% of those were left turns, for example. As I mentioned, we also looked at 5 years worth of all bicyclist and pedestrian crashes in North Carolina that spanned between 2012 and 2021. That was in total about 31,024 total crashes in that 10-year period. About 71% of those were pedestrians and 30% were bicyclists. We looked at injury classification, the context, whether it was occurring at an intersection or not, various roadway characteristics, multiple ways of describing it from a socioeconomic and demographic characteristics, time, weather conditions, and a lot of other factors. And again, we produced this analysis both for the statewide as well as for each MPO and RPO. Some things that we found with this broader analysis spatially is about 46% of those fatal and serious injury pedestrian and bicyclist crashes occurred on arterials, both minor and principal. And about 70% of those crashes occurred on roads with posted speeds greater than 35 miles per hour. Other things that were also very similar to what we learned in the sample review, again, about 73% of those crashes occurring outside of intersections and 65% occurring in the dark conditions. The consultations, again, were to learn more about what's happening at the local level. We conducted outreach to a number of organizations and especially had a number of really helpful conversations with each MPO and RPO. And the purpose of that was to identify the types of locations that could be considered or described as high risk, also communities of concern or populations that they know to be especially vulnerable to serious injury and fatal pedestrian and bicyclist crashes in their region. And also to share some of the resources that both they can tap into as well as other resources NCDOT has to offer. So the report for Vulnerable Road User Safety Assessment, again, was submitted back last November, includes an overview of the process, its relationship to multiple other programs in North Carolina, a summary of the quantitative analysis, as well as some technical appendices that go deeper into that, and a summary of what we learned from the consultation, and then also a series of strategies that Brian will go over in just a moment. So with that, I'll turn it over to Brian.
Thanks, Lauren. Appreciate that. Yeah, it was a very good exercise for us. Like I mentioned before, it kind of built on what we had already been working on in NCDOT. And we didn't necessarily learn a whole lot of new items from the data analysis. We were aware of those trends, but it was really good to see it kind of put together in one place at one time. And one real key thing was the engagement and all the conversations that took place with the MPOs and RPOs in particular to get those other perspectives and make sure that they were aware of the data that was available and the trends. So, what we needed to do then was kind of turn all this data and conversations into, as you see here, a program of strategies. What can we do with this? And really for us, kind of the decision that we made throughout this process was really to frame it in three ways. And one was we wanted to make sure that any strategy that we came up with, we felt reasonably confident would reduce fatalities and serious injuries. That is a primary focal point of the HSIP program. It's a focal point of this committee. So we wanted to make sure that stayed as a focal point for most of the strategies as well. Another framing point for the strategies was to rely on data. We just went through a big process, as you saw, to look at data every which way imaginable. We wanted to make sure that we connected that data to the strategies. And then the last part was to take advantage of those partnerships. And so many of the strategies that we recommend are going to continue to build on those partnerships that we established and look for new ones that we can rely on as well. We cannot reduce fatalities and serious injuries by ourselves with NCDOT. We have to have ongoing conversations and, continuous work and effort and sharing of resources on this topic. So next slide, Laura. So I'm not going to read each one of the bullets as we go through, but I'll kind of give you an overall flavor of what we mean with these strategies. And on this one in policy, one thing that we realized is that there was a gap in guidance out there on many topic areas, such as we can give an example for trail crossings. There's a lot of multi-use paths being built. There's a lot of greenways. They're wonderful things, communities. They're going to cross a road at some point, and where they're crossing the roads, we realized we did not have any guidance for engineers, for planners, for our community to make sure that when we establish these crossings, whether they're there previously or new ones, that they're done to an appropriate safety standard. As you probably picked up on from the data that Lauren shared, most of our fatalities occur when people are crossing the road. Some do occur as they're walking alongside the road, but the vast majority are when they're crossing, whether it's at an intersection or especially away from intersections. So that's an example. We're working on trail crossing guidance. We're working on guidance for signalized intersections as well. Bus stops would be another example. There's not a lot of information that NCDOT provides or publishes on what are the best practices when it comes to pedestrian safety as it relates to these type of items. So that's an example. Next slide. So for planning, this was kind of one that I've talked about a lot in different venues across the state. One of the key things here, and I think it's vitally important, is for us to make sure that we have local and regional safety action plans. Most people have heard me say a few times now that I want every MPO in particular to have a safety action plan, a comprehensive plan. And that will be more than pedestrian crashes and bicycle crashes. It would be for all crash types. But it will include naturally a significant focus on bicycle and pedestrian safety. And we're looking at ways to take this maybe in a slightly different way to smaller and mid-sized communities and RPOs as well. But I think it's vitally important for our MPOs, for each one to have a comprehensive safety plan. And so that's showing up as a strategy in this as well. One valuable thing for that is you have so many rich conversations. You start taking the data, you do robust, high quality engagement with the public. You give them an opportunity to go through these processes of identifying what's important, how to allocate resources, what kind of projects are needed, perhaps what kind of legislation that they would like to work towards. But by doing that comprehensive plan, it allows those conversations to take place, not just here at DOT or in our boardroom, but in a local setting, which I think is incredibly valuable. Next slide. So in the program area, we have a lot of programs that are already established that we've been working on the last few years. We've done a lot of pedestrian safety work, kind of in a pilot approach with Wilmington and Fayetteville. Also in downtown Raleigh, we've learned a lot. It was labor intensive, but and data driven. But we want to take what we've learned in addition to what we learned from the vulnerable road user assessment, and figure out appropriate ways to scale that. And so one example is something that I'm kind of excited about is we're trying to figure out how to develop a small city pedestrian safety program. And by small city, we'll call that population 5,000 and less, because they're often left out of our programs. When we look at our data generally, it's going to be dominated by Charlotte, Raleigh, and a few other large cities, Wilmington, Fayetteville, and we're going to continue to focus on those because we have to make a difference. But there's a lot of small cities across the state that have pedestrian safety issues that we've identified. And we're looking for ways to take the Transportation Alternatives Program, as well as our HSIP program, and look for opportunities to provide the infrastructure, such as sidewalks, but also really focus on safe crossings, whether it's at a signalized intersection or away from intersections, and really kind of come up with a way to to combine those two efforts into something that can help those small cities. So that would be an example of developing a program that then can be in place year after year after year and hopefully deliver, measurable results. For the projects, that's a good example of this is one thing that we've learned and learned well is there's a lot of countermeasures for bicycle and pedestrian safety that are low cost. And we need to try to leverage those systemically and across the state. So for one example would be the pedestrian head start. Many of you guys have seen that at signalized intersections, especially in downtown Raleigh, where the pedestrian is able to get a little bit of a head start at a signalized intersection prior to vehicle traffic moving. And that's a known countermeasure that can improve safety as well as comfort for the pedestrian. There's trade-offs with everything that we do, but that's a type of countermeasure that we think we can deploy wide scale across the state. So that would be an example in this bucket. Education, one thing we heard again and again and again is, what do I do at this location? What do I do in this situation? What's the best practice? And even though there is a tremendous amount of information out there, some of the things that were identified is we need to organize it in a way and structure it in a way so that people can find the information that's relevant to them for the decision that they're trying to make. And that could be at a planning level, but it often is at an implementation level, at a project level. And it can be STIP projects, large projects, small projects. And so we're really trying to bring a lot of focus on, training resources and classes that we need for both consultants and for local governments and for our NCDOT staff. One thing that's going to be a focal of this is road safety assessments. We're looking at different ways to leverage our programs to both train and teach and perform a lot of road safety assessments across the state and use that as a way to partner with local governments and our planning agencies. So with implementation, one thing you picked up from Laura's presentation and from what Lauren shared as well is data. Like data is everywhere. There's a lot of it, but you'd be surprised how much data is lacking in the bicycle and pedestrian realm, especially to have it structured in a way for us to make quick and efficient decisions. So on the data, one of our focal points will be developing those resources and continuing to make them available to our partners as well, especially in areas of risk and exposure. So I hope that gives everybody an idea of what we did for a vulnerable road user assessment. Again, we'll update it along with our strategic highway safety plan in 5 years. But just also wanted to thank Lauren and the VHB team. They were very instrumental in helping us keep this moving in a good direction. So thank you.
Brian, thank you, and Lauren, for the presentation. Any comments or questions for either one of these folks? And Lauren, thanks to you and your team for all your help on this too. Appreciate y'all. Y'all been a great partner to us over the years, and appreciate everything y'all do, and not just in the safety realm, but everywhere y'all are able to help us.
Very much. Thank you.
Mm-hmm. So now we're going to move to the 2024 North Carolina Strategic Highway Safety Plan update, and I'm going to ask Kara Peach to take this. Kara, are you there?
I am. Thank you. Can you see my screen?
Yes.
Excellent. All right, great. Well, thank you so much for having us today to talk about the Strategic Highway Safety Plan update. We are nearing the draft plan and nearing the end of the process, so we're excited to be here. Today, I have a number of slides. We want to provide a brief overview of where we are in terms of the data analysis, the stakeholder engagement, and where we are in terms of drafting the plan. And then we also have several action items that we hope to present to the group here today. And so this will be not interactive so much, but we really do want your input. So feel free to chime in as we walk through the slides. As just a quick refresher, We are in the 2024 update of the Strategic Highway Safety Plan. This is a 5-year strategic plan. The last update was completed right at the end of 2019. And I believe I came to provide an update to this group of January 2020. And who knew that just a few months later, many of our traffic concerns would shift very quickly. But so the 2019 plan had 11 emphasis areas, which are the crash types or areas of concern that rose to the top in both the data and the stakeholder concerns. And the 2019 plan also included the goal for highway safety, traffic safety in North Carolina. And that goal is to reduce fatalities and serious injuries by half by 2035, moving towards 0 by 2050. And we'll revisit this goal as we're looking to update the 2024 plan goal. So first, the Strategic Highway Safety Plan is a data-driven plan. And we've heard a lot of data already today from the previous presentations. Chris showed some preliminary data from 23 and 22, and we're seeing that slight downward trend, but you can see the trends continue to be increasing over the time. I think most notable on this slide is to point out here that jump in the fatality rate, which occurred in 2020 as VMT did decrease, as we all know, but the fatalities did increase. So that had a sharp increase on our fatality rate, which is significant to know. Hopefully we are continuing to experience a downward trend. And then we saw the average annual fatalities by emphasis areas. Chris earlier presented the difference between 2022 and 23, seeing that we do have some slight decreases in those emphasis areas. But what you're seeing on the screen is that we're showing increase, but this is looking at 5-year averages. So the number on the top of each emphasis area here is the 5-year average as shown in the 2019 plan. The 20 as of 2023, and then this percent change is the difference between the 5-year average of the 2019 plan and the 5-year average with the data now. And so you'll see some significant increases over the time period here. It's just important to note that, addressing any types of these emphasis areas or crash types in North Carolina could have a significant impact towards achieving 0 fatalities and serious injuries. We did look at some other contributing factors beyond just the fatalities and serious injuries. Of course, there's many contributing factors to these crashes. And you'll see, of course, I think we all know in North Carolina that we continue to be one of the fastest growing states. We're seeing a lot of growth in our urban areas, the Triangle, the Triad, Charlotte, Mecklenburg, Wilmington, these pockets of urban growth. And we are, VMT is showing that it is rebounding. We're close to reaching those pre-pandemic years, as you'll see. And what's really notable here is that our urban VMT is nearly double that of the rural VMT. And this underscores the importance of context. So we really are thinking about what types of crashes are happening in the state, but we're thinking more nuanced than that of where are those crashes happening and what does that mean for the strategies that we develop for this plan. And so we need to consider those specific challenges. So if we're thinking about the urban VMT, then we're likely going to see more of those urban types of crashes, and so or those concerns. So this is where we're going to see more of those non-motorists, where they represent a greater share of the severe crashes compared to the rural areas. And so when we think about those numbers that we've talked about already today, that some of those non-motorists, pedestrian, bicyclists, where they represent a small percentage of the crashes. But what's notable here is that they hold a greater proportion of the fatalities and serious injuries. So they're more dangerous crashes. Of course, we're more unprotected as pedestrians and motorcyclists, and we see those crashes occurring more frequently in those urban settings. But that's not to say that we don't have the challenges in the rural settings. So on the other hand, we see that rural areas may have less crashes, but they're more severe. Non-motorists. So you'll see there's a significant difference in that fatality rate and serious injury rate in the urban versus the rural communities. So you'll see that we just have higher rates of fatalities and it's just significantly higher in those rural areas. And one of those is lane departure, which is the largest severe crash emphasis area in North Carolina. So just a notable statistics here is that North Carolina is the 22nd highest state in terms of rural non-interstate road mileage, but third highest for number of rural non-interstate fatalities. So we know that those lane departure crashes are happening, and they're also very severe. So what does that mean when we start to look at this plan? Knowing that each of those types of crashes that we've highlighted today and several types of crashes don't just happen on their own. There's many contributing factors. So we looked at what else is related to these crashes. And so this is just one of the samples I have up on the screen where we looked at the seatbelts and car seats, so restraint use, and what are the other crashes that are happening with that? And you'll see that there's a 46% of those involve lane departure, 25% occur at intersections, and that 22% can include substance impaired driving. So what that means is that if we can improve one of these crashes, if we improve our lane departure crashes, then we might prevent a crash or prevent severity of a crash or prevent a fatality, save a life. And so when we need to think about each of these emphasis areas, not as standalone, but coming up with strategies that can really think about everything that's contributing to that crash. And so what does that mean for the plan? Well, one of the key factors that we wanted to incorporate into the 2024 update was the safe system approach. And one of those key principles there is redundancy is crucial. So if we have multiple stakeholders like yourselves on the call who are working towards addressing the challenges and the crashes, then we would have have more impact on achieving zero. So if we have enforcement and adjudication working towards impaired driving, we may reduce the severity or this crash. We have strategies that are focused on improving seatbelt usage and proper restraints in the car. Again, we might be saving lives that way. And what else that means is that we need to consider the context in terms of implementation and knowing that one size won't fit all. When we think about those rural differences and the urbans, the crashes are happening in different ways in different settings. And that means that we need to have multiple partners at the table to be developing strategies and implementing strategies together. And so that brings us to our stakeholder-driven process. And the second key component of the SHSP update is to engage safety partners to vet the data, provide additional input, and start to develop the content for the plan. And so we engaged stakeholders several ways. We kicked this off in August of 2023 with a safety series, which was a nearly weekly event where we had guest speakers from across the state, several of which are on the call today. And thank you again for participating in that webinar series where they presented on a range of key safety related topics. So we saw everything from speed safety cameras at the federal level to some of the key work that Elise and Lydia and others at the local level are doing in terms of implementing safety action plans. And of course, Brian and Lauren presented on the vulnerable road user assessment. So all of these presentations were really to get us keyed up to understand what's happening in each of these emphasis areas by some of the leaders across the state. We had the first workshop for the Strategic Highway Safety Plan in early September, and this is it was a nearly day-long event. Again, many of you participated in that event, and we thank you all for that ongoing feedback and participation to vet the initial data and help direct and direct the plan, direct the different emphasis areas. And a few key points that we heard during that workshop was that we heard there was more desire for more implementation. So more emphasis on implementation, developing a plan that could be implemented, more regular engagement between plans. 5 years is a long time period with a lot of work going on, and they would like to see more regular engagement. And then also some more maybe public education or support around the plan. So we've developed this plan. What does it mean? And how do we get more emphasis on safety more broadly across agencies, partner groups, advocacy groups, but also the general public as well. Following the stakeholder groups from about November through late January, we had individual emphasis area working groups. So we had 7 working groups who met 3 times. We also had 1 joint working group meeting between safer speeds and intersections and pedestrians, bicyclists, and personal mobility to look at the overlap between those strategies. And the task for the working groups was to sit down and clarify the emphasis area. Are we addressing the right problems in North Carolina? What's their vision for safety related to that topic? And then what are some key strategies and supporting actions that will help us achieve zero within that plan? We emphasize a lot that this is an NCDOT supported plan, but it is not an NCDOT plan. It is a state plan. And again, as we say, redundancy is crucial. We need all of those different partners working on the plan together. So that brings us to the draft plan as we are working on now and working towards getting the final plan by early May of this year. And so just a few highlights as we are working through that plan that we wanted to point out. We do have 9 emphasis areas. So I'll go over that in the next slide, what those emphasis areas are. The plan really focuses on that safe system approach as well. And it did introduce for an equity component using NCDOT's Transportation Disadvantage Index, or the TDI, which is a series of relative metrics that compare local communities to the county, regional, and statewide averages. Some of those components can involve population under 15, population under 65, population below the poverty line, zero vehicle households. And so we are using those, the TDI, because there is a strong correlation between the TDI and historically disadvantaged communities in terms of traffic safety. And so we want to think about how we can focus on that context once again, and the implementation, and thinking that implementation of one strategy for one crash should not be applied evenly across the state, that context matters, and we need to be thinking about what are the considerations specific to that area that need to be tailored to the implementation. We also want to highlight some ongoing related efforts, doubling down on what works. We know there are amazing programs in North Carolina that are working every day to promote safety for all modes, and we want to highlight the positives in the plan. And we do want to make that strong connection between the data and the stakeholder vision. So we're trying to make a stronger connection in this plan that emphasizes how these 2 components come together to develop the strategies and supporting actions. And again, thinking about what is implementable in the next 5 years. And that's a really big challenge and a big task that we ask the stakeholders to think about. You know, we think, what's this magic wand moment that we had talked about in the first workshop, that, you know, what if you could do one thing to improve safety, what would it be? And then we have to challenge ourselves to come back. So what's the first step? What can we do tomorrow when we leave our desk, or this afternoon when we leave our desk, to say, what can we do to take that first step towards achieving that vision? So there are 3 outstanding pieces to the plan that we have for you all as the executive committee. We would like to include a signature page of support for the plan. We do have an acknowledgement page for all the stakeholders. We've had many stakeholders involved in updating the plan and process, but we'd also like to have some stronger support with agencies providing their signature. And that's something that I think Chris Oliver will follow up with everyone, of how do we strengthen and give this plan a little bit more buy-in from all the agencies. We also need to get with the action plan, some champions. We have some gaps where we'd like your support in dedicating yourselves, committing yourselves to helping to implement and take the lead on some of the strategies and supporting actions in the plan. And then we'll review the goal for 2024. So as I mentioned, we do have 9 emphasis areas, very similar to the 2019 plan, with just a few notable changes here. Alertness is no longer an emphasis area. That group did meet and decided that they felt there's just one key strategy, which is the hands-free bill, and that alertness is something that could be integrated within all the emphasis areas. So they did not feel the need to be an emphasis area specific in this plan. Also, data and emerging issues is more involved in and added to all the emphasis areas. So that's how we got down to 9. We did change a few of the names here. As you know, before we had speed, and now the group really felt that safer speeds was more reflective of what the vision for the speed related topic would be. And that's similar to the seatbelts and car seats, which was previously occupant protection, which for some felt like we were really talking about some that would include some in-vehicle technologies, and the strategies and supporting actions the group were focused on was really more of that passenger restraints. And so that would evolve to the seatbelts and car seats. And so this next piece is where we're really looking for help from you all. What I wanted to emphasize here, we're going to walk through each of the emphasis areas. I know that there are 9 of them, so we will try to be efficient in this. But for each emphasis area, the groups developed action plans. And within the action plan, there was the strategies, which are the goals of how we're going to achieve zero. And the supporting actions are those steps that achieve that strategy. So it's broken down of more of like the supporting actions are what we're going to implement. These are the key steps that we can take in the next 5 years to get to that strategy. And then each action plan includes, or each supporting action includes a row for champions. And the champions are those stakeholders who can either lead and can make changes, make implementation, or those who can support, that feel like they're have a strong voice and have a good network and would like to help support implementation, but maybe don't feel like they're the leader in that area. So we ask that the participants in the working group to volunteer themselves as either leaders or support under our champions. And at this time, we do have, as I mentioned earlier, several gaps in those areas for champions that we're hoping to see some involvement from this group that are willing to commit their agency to help support. With this being the focus on implementation, if we do not have a champion for a supporting action, then we won't be able to include it in this plan. It's a great vision. We have many ideas of how we can implement and change safety, but it does rely on partnership through agencies. And so we really feel strongly based on the stakeholder input to make it implementable, we have to have a champion to support it. So I'm going to walk through the really high level, what the strategies and supporting actions are for, or some of those gaps in the supporting actions for the emphasis areas. So we'll have these slides, you'll see just a quick little data pull, the number of strategies and supporting actions. You'll see on lane departure, we have all champions identified. And so that's a great first step, and we start off in a great point. The next one is intersections. We have 6 strategies and 23 supporting actions, and we do have 2 champions here that we're looking for. This working group focused on the frequency and severity of crashes, low cost, quick build designs, and then also awareness and acceptance of different intersection designs. So you'll see the supporting action where we could use the most support here is on strategy 6, which is researching and implementing effective ways to better ensure compliance with traffic control devices. And we do feel like this could be an area where enforcement and adjudication could help support either of these supporting actions. And because I don't want anyone to have to read all this, we're happy to follow up with more information afterwards. But if you do see something that piques your interest and you would like to volunteer to champion this, please use the chat box or raise your hand, and we can pause and talk about any of these topics. So next is the pedestrians, bicyclists, and personal mobility. As Lauren and Brian emphasized earlier, the VRU is a key component of the SHSP. So we took the work that the working group developed and we aligned that with what's in the VRU. And so several of the strategies and supporting actions were direct relationships, which is the purview of NCDOT. NCDOT is the champion of those specific efforts. But what that does is that leaves 11 areas where additional support is needed under this. We have 5 strategies with 15 supporting actions. And you'll see there's a couple here that highlight where those champions may be needed. And I've put a couple on the slide here. We do think that second strategy could use support from Governor's Highway Safety Program or any others that would feel like that's a good fit. And strategy 3, also Governor's Highway Safety Program, State Highway Patrol, DMV. These are areas where your input and your champion would really help implement and move that forward. Okay, then we'll move on to seatbelts and car seats. 4 strategies, 19 supporting actions with 5 champions needed. The vision for this working group was on proper use, proper restraint use, regardless of position and vehicle type, and then also access to appropriate car seats. So that was really important to this group, is making sure we're getting the car seats in the hands of the people who need them. And you'll see that we have one here on seatbelt policies. And so this is really one that could be open for anybody. We see the opportunity here. The strategy is really from that safety culture perspective of the idea of building safety practices into policy. And hopefully, that could encourage you outside of your fleet vehicle to use your proper restraint. And then substance impaired driving strategies. This working group focused on enhanced prosecution, more data, and there was interest in lowering the BAC. These were all important topics in developing the substance impaired driving strategy. And a couple up here I wanted to highlight. So we do have a very strong partnership champion from Atrium Health, as you may have seen on the safety series slide. And if you were able to participate in that safety series back in the fall or late summer, that Janice gave us a great presentation where they are doing research in the ER and the trauma centers and with the coroner's office of doing blood draws to understand the true pervasiveness of impairment within anyone who's been involved in a motor vehicle crash. And so they're doing great research in the Charlotte area, and there's a lot of passion behind that, but we do see that they need some more support from the DMV, State Highway Patrol, to take their data that they're finding and really help implement some changes across the state. So I think that there's some real strong opportunities to build on that relationship and that partnership with Atrium Health and that research. And safer speeds. This group is really focused about creating a safer system that encourages slower speeds, and then knowing that behavior will follow. So we create a roadway and a system that would help make the slower choice the easier choice, if you will. And this relies a lot on data collection to inform decision making as well. So a lot of great ideas here. You see, we do have 11 champions. This is a very important topic for, I think, many people at the table. All of us at the table understand the challenges associated with speed. But if we were to reduce speeds, I think we'd have a great impact across many of those emphasis areas. So we're looking for champions to help support this. I did pull up a couple here on the screen. Strategy number 2, this is strategy 1 and strategy 2 were very focused on data analysis, capturing data, understanding what the data means. And so this could use support from the TRCC, the State Highway Patrol, researchers, any of those wonderful data sources that we have, pulling them together to paint a richer picture of what speed means across the state. So I wanted to pull that up and provide that the opportunity to review those. Older drivers, we have some great researchers here in North Carolina. We're very lucky to have a partner out of ECU who is renowned across the world for her research in older drivers. And so very lucky to have that support here. Wanted to pull up strategy number 2, as this is one that could be looking at how do we help review older drivers and their ability to be driving. And so we see some partnerships here with Governor's Highway Safety Program, the North Carolina Coalition on Aging. They did volunteer to be champions for this, but we do feel like this is a good opportunity to partner also with DMV. And then motorcyclists, this is one of those top emphasis areas where the severity of crashes is very high. A small percentage of crashes are motorcyclists, but the severity is very high. We see the need for 11 champions here. The vision for this group was both on understanding motorcycle crashes, where are they happening, why are they happening, and who all is involved with them. Motorcycle crashes and motorcyclists, the bikes can be different, the rider experience can be different. So the importance of proper training and proper gear, but also the combination with the infrastructure that I think many of us don't think about, maybe from the infrastructure point of view, from maintenance practices and construction practices that could have negative impacts on the bike's ability to stay on the road. And so they're really looking at infrastructure ways that we can change our infrastructure practices to help improve safety, make it safer to ride the bike on the road. So again, with the emphasis on data collection and understanding these crashes, some opportunity for TRCC or other data-oriented researchers for strategy 3 and strategy 4, improving the roadway maintenance and construction practices. So this could be a joint role for many partners. And then for the last emphasis area, the younger driver strategies, there are 3 strategies with the need for 3 champions. And those champions are really looking to, reinforcing that driver education and the licensing procedures. And so we do have support from DPI at the table for as a champion for these, but we see a good coordination needed with the DMV as well. And I do see that the chat box has been very active, and hopefully we can follow up with you all to see how we can map what you all were saying with the strategies that were up there. So thank you for that. And we can also follow up after this meeting. We do have another workshop coming up. It's the last workshop where we will once again be looking at strategies and champions, and that is on Tuesday, March 19th. We will be sending a save the date for that, hopefully next week. It will be in the morning at the McKimmon Center here in Raleigh. It will be between 8:30 and noon, I believe, on that Tuesday, and we hope you all can join us. Again, we'll be sending more information on that, and you will receive invitation for that. But we are also happy to have any other conversations and share these draft action plans and the draft plan. They will be circulated to all stakeholders prior to that workshop, but we're happy to have other conversations with anyone leading up to that event as well to go through these different pieces. So The last piece here is to review the goal for the 2024 plan. As I mentioned, there were 3 asks for you, and this is the third. So just a reminder of where we were in 2019. The goal is to reduce fatalities and serious injuries by half by 2035, moving towards zero by 2050. And so there are several approaches. I'm going to put 2 up on the screen, and I think I'm going to let Brian take over and review the options, and the conversation.
Right, thanks, Cara. So this is a participation moment for the group that's with us today. We are asking for feedback and for this group to kind of express or ask questions or express a preference on these 2 options. And I'll give you a little bit of background. Typically, the Executive Committee for Highway Safety does approve a resolution in support of, and Chris Oliver, please correct me if I'm speaking on any of this, but we typically do, a resolution of support or agreement with the goal that is set through the Strategic Highway Safety Plan process. So the Strategic Highway Safety Plan, as you just heard from all that wonderful information, is a very engaging process. A lot of stakeholders participate in that. And it's a lot of good conversation, not just on the strategies, but what should the goal be for North Carolina. Historically, North Carolina has selected a very aspirational goal, and that's what you see here. Both of these are aspirational goals. They're probably the right goal. And I mean that from what's the right number of fatalities and serious injuries for North Carolina? What's the right number for you or your family? We all quickly come to 0 as the right number. So the reality is it's going to take a while to see those numbers decrease. You heard our secretary mention earlier today that the numbers have gone down some this year, but they went up pretty dramatically during COVID, right? So it's a challenging issue. I will say that from a goal selection perspective, it does inform our formal targets that we set and provide on an annual basis to FHWA. There is not a penalty associated with us not meeting these goals in terms of a financial penalty from FHWA, or it does not affect our NCDOT operations from that perspective. However, we do recognize that these goals inform all of our stakeholders and ourselves of what we're trying to accomplish. And it also helps kind of communicate how big of a job this is. So before us today is these 2 options. One is just keeping the goal the way it is, which was reducing fatalities and serious injuries by half by 2035, moving towards 0 by 2050. Or do we acknowledge that in the last 5 years, the trends went the opposite direction? Overall, the last 5 years, we had many more years that increased than decreased. In fact, all of them increased. And so do we acknowledge that and say, let's keep the goal as terms of reducing fatalities and serious injuries by half, but let's acknowledge that we're going to need more time to turn that trend around and move that to 2040 or towards 0 by 2055. And if anybody would like to ask questions, we'll be glad to clarify that, but we are looking for the members of the group to express a preference for one option or the other. Chris, is there anything you want to add from a procedural standpoint?
And Brian, I think you're on point. I mean, ideally, we would like probably a formal vote so we'll know how to proceed as far as the goal is concerned with this Strategic Highway Safety Plan update. I think there is one comment, or actually 2 comments. I guess Terry is with Bike Walk is for option 1. I think Heidi is basically expressing the same, that I think the goal should remain the same. So not sure if there's needs to be open discussion or just a formal vote. I guess we're open to both. We see quite a few folks chiming in the chat.
So Brian and Chris, a procedural question for me. This is Joey. Does everybody in the meeting have I guess the right to vote? Who are the official members of the executive committee?
Yeah, I was about to bring that up. Chris, not to put you on the spot, but can you maybe run through our official voting member list? Remind folks of who those are.
Yes, sir. Let me see if I can pull it up right quick.
And I know this is usually a little easier in an in-person meeting than a virtual to do a vote, but we'll manage through it today.
Yeah, our current members are Ike Avery, Mark Ezell, who isn't with us today, Commissioner Goodwin, Tony Hayes, Commander Freddie Johnson, who isn't with us today, Chris Lundkiskin, I just tore his name up, sorry about that. He's with the NPOs. Brian, you are a member, John McCormick, Lydia McIntyre, Laura Sandit, and then Billy Williams.
So, and I don't know what the procedures are, Chris, if there's an absence, like if Mark or Freddie's not here, does their vote go to their representatives or what?
Yes, sir. I think ideally, if a representative is here, then we certainly can move in that direction.
Well, why don't we just go through the list then? And I don't want to cut people short. If there's anybody that wants to speak on this on the call, let's do that too. But once we get through there, let's go through the list and just do a verbal vote for the members. I do see, I think we've got somebody's hand raised now. Lydia McIntyre. Yeah.
Yeah, I was just gonna ask, initially I was thinking option one, but I did want to ask about, because it's something I see different between this plan and the previous plans, that we're trying to get champions to make sure that the strategies move forward. And I was gonna ask about how are our strategies tracking from the last plan? Like, did we see any significant movement in those to say this is why also we're proposing the option two, because this time we actually are identifying champions to take these strategies on to make an impact.
Yeah, Chris, do you want to?
Yeah, we certainly we did see some movement in terms of trying to implement the strategies with the last plan, but certainly it makes it difficult because it seems that DOT is, I guess in most people's eyes, the one that's supposed to be moving the plan forward, but it's technically a plan for all the safety stakeholders. So that's why we tried to move forward with this plan, to try to identify actual champions, so that so hopefully we'll have a better chance at implementing the strategies with this plan. And again, if we can't identify the champion, then the thought is that with that particular strategy, we just will not move forward with this update.
And Lydia, let me maybe help too by asking another question. Chris, appreciate your response. Kara, since we hadn't had a chance yet, but thank you for your presentation. That was a lot of good information. But in regards to the question Lydia asked about the champions and then your request for the number of champions we need, what kind of time frame do you want feedback from either suggested champions from this group or volunteers? What would be a good time frame for people to respond to that request?
Yeah, that's a great question. Well, we do have that second workshop on March 19th. So we'd like to have as many champions as possible identified by then, so we can use that March 19th as the last opportunity from the stakeholders to point out any gaps that we do have and make those final decisions. We are going to finalize that plan by May 1st is the goal. We do need to have it completed by May 15th. So May 1st is the goal there. And so we'd be looking for inputs from this group by, I would say, the end of February. So the next a little less than 2 weeks.
Okay, so that helps me out. So let me take it a step further then. So March 19th is a workshop. You want something by the end of the month. When is the registration deadline for the workshop?
So we'll have that registration. We'll probably close that, or not close that. We never really close it. Anyone is welcome to come, but to help get our numbers set by March 8th. So that is why the hope is we get that save the date out as soon as possible. The working groups were notified of that date but we do want to get that out to everybody.
Okay, thank you for that. So in a point of executive privilege, so by the end of this month, I would like to ask you to circle back with Brian Mayhew and also Ryan Brumfield with DOT with any champion needs that we have. And then hopefully before March 8th, we can suggest names for any current, or, it may not be just be names, it may be organizations to fill any leftover holes. And I want to go ahead and caution folks, you're part of this committee for a reason. If we would love to have these champion volunteers participate and help move these efforts forward, knowing that everybody may not have the time or may not even be the right fit for that. But hopefully you can help us come up with another name that can be a champion, somebody that we can reach out to. Like Chris was saying a minute ago, a lot of this seems to fall on the backs of DOT, and that's understandable, but we cannot carry this weight all by ourselves. We have to have the good people and good organizations of this state to really make a difference here. And we're going to reach out and try to get that help to make this plan be effective and drive us toward which one of these options that we come up with after the vote. So thank you for that. I ask that you think about that. If you know somebody or if you're willing to do it, please let Kara know by the end of the month. And Kara, please, if you can, circle back up with Brian and Ryan that first week of April. So hopefully we can fill in any gaps, but I don't know that there are going to be any gaps. I think everybody's going to stand up and take an opportunity to be a champion at one or more of these strategies and goals. Other questions or comments? So Chris, if you don't mind, if you'll read the names of the voting members, and if you're here, please go ahead and decide whether you support retaining the 2019 goal, which is option 1, or proposing option 2 or revising the goal to option 2. If your organization is not represented by their named member, then we would take a substitute for that too. Is that correct? Do I understand that correct? Yes, correct, Joey. Okay. All right. Go ahead, Chris.
Ike Avery.
On behalf of Conference of DAs, vote for option number 1. It's a goal, and I don't think we ought to reduce our goal, even though we are definitely facing headwinds.
All right. I guess for Mark Ezell, I think Cheryl Leonard is on the call.
Yes, on behalf of Governor's Highway Safety, option 1.
Commissioner Goodwin.
Again, good morning. Certainly see arguments on both sides. Certainly defer to the experts. Option 1 appears to be a good vote, but I'll cast that vote at this time. But I'm subject to whatever anyone else wishes to advise me, Mr. Secretary.
Okay. Tony Hayes. He was with us earlier. He may not be with us now. Not sure if we have a representative for the highway patrol, Freddie Johnson. Hearing none. Also, I'm not sure if we have a representative for Chris Lucina.
Yeah, Lucasina, and Chris, Lydia is here to represent not just the city of Greensboro, but also MPOs. So I think Lydia can vote.
Okay, well, go ahead.
Yes, yeah, since I'm representing the MPOs, I understand, given the option 2, but based on, I'm representing the MPOs, option 1.
Okay. Brian Mayhew.
I'll vote for option 1. I'll just make a quick comment that, Lydia, that in particular, we do take this goal and we establish our statewide annual targets, which will mean that those targets will become more aggressive and need a steeper decline each year. And that will be reflected, Lydia, with the targets that are passed on to the MPOs. So I'm just sharing it with you so you can share that information with your colleagues. But my vote, Chris, is option 1.
John McCormick. I'm sure if I think he joined us today. Laura Sandin.
On behalf of the Highway Safety Research Center, we support option 1 as well.
All right, Billy Williams. Entry.
Yes, option 1 also.
All right, so we didn't have a few members. I think it's pretty obvious. Option 1 is the majority vote.
I think that carries.
Oh,
I think it was unanimous, wasn't it?
it was.
Yeah. Thank you.
Thank you.
Thank you for that, Chris. Brian, does that cover the next item?
It does.
Adoption of the goal?
Yeah, we kind of agreed ahead of time to kind of group those together. So yes, it does cover that.
Okay, great. So thank you all for that, and thank you, Chris, for doing that. The last item on our agenda is agency updates. So I'll start on the Department of Transportation side. Is there anyone, Brian, any of your team or any of the other members of our team on here that have any updates?